So, metabolic health, it's this overarching concept that's not as straightforward as, oh, I'll just eat less sugar, right? It's about how efficiently and effectively our bodies process energy, which impacts nearly everything, from how we feel day to day to our long-term risk for chronic diseases.
Okay, so first of all, I didn't even know metabolic health was a thing, you know? Like I thought metabolism was just that thing you blame when you gain weight after 40. What's actually going on here?
That's a great point, David. It's actually much broader than just weight or metabolism in the popular sense. Metabolic health looks at how well your body balances things like blood sugar, cholesterol, blood pressure, and inflammation. And this balance plays into whether people develop things like diabetes, heart disease, or even the cognitive decline.
Wow. So kind of like the cornerstone of health, huh?
Exactly. But, and this is important, our modern lifestyles and the food systems we rely on make it really hard for many people to maintain that balance. A lot of those systems are shaped by corporate interests, from how food is marketed to the medications we end up needing down the road. It's a tangled web, really.
Oh man, we're already diving into the deep stuff. But before we go too far, can I just mention something for transparency?
Of course.
For anyone tuning in, quick disclaimer. This podcast, everything you're hearing, is created with AI voices. Sophia and I are advanced digital clones, backed by years of real-world expertise and incredible care from Dr. Chad Swanson. He's an ER doc and changemaker who built this project as an informal conversation with the world about creating healthier systems.
Right, and while we strive to make everything evidence-based, it's still a conversation. So definitely cross-check any references we make if you're investing in these ideas further.
Perfect. Okay, so we're talking today about Casey and Calley Means. Tell me, what's their deal?
They're siblings who are passionate about helping people understand and improve their metabolic health. Casey, for instance, is a physician who's forged this new path into preventive health technology. It's fascinating. Calley, on the other hand, really hones in on how food systems and policy interact with health outcomes. Together, they make such a powerful duo.
Kind of sounds like they're not just fighting diseases, they're fighting the root causes. I love it already. So, Sophia, you brought up Calley Means earlier. She sounds like a fascinating figure. Could you unpack her story and what makes her approach to preventive health so groundbreaking?
Casey is incredible. She's the Stanford-trained physician who co-founded a company called Levels. Their focus is on metabolic health, specifically improving it through continuous glucose monitoring. Essentially, it's about showing people what's happening inside their bodies in real time.
Wait, like you're constantly tracking your blood sugar levels? That's like some sci-fi stuff.
It sounds futuristic, I know, but it's more accessible than you'd think. These devices help people see how their daily choices, like what they eat or how stressed they are, affect their blood sugar levels. And when you have that kind of insight, you can really start tailoring your behaviors to improve your overall health.
Okay, but how does blood sugar connect to everything else? Like, why is this the thing we're focusing on?
Great question. Blood sugar spikes and crashes might seem small in the moment, but over time they contribute to insulin resistance. And that's a common pathway to things like type 2 diabetes, heart disease, and more. Real-time monitoring allows people to catch these patterns early and make adjustments before things spiral out of control.
So it's not just about controlling major diseases. It's about, like, preventing them from even starting. That's huge.
Exactly. Casey emphasizes this idea that metabolic health isn't fixed. It's dynamic and can be improved with the right interventions. And those interventions are often lifestyle-based, personalized nutrition, exercise, stress management. With real-time feedback from something like Levels, individuals actually get to see what works for them, which is so empowering.
I mean, it makes sense. But aren't there a million things that affect blood sugar? I feel like I wouldn't even know where to start.
You're not alone there. That's kind of what Casey and her team are tackling. The feedback loop is key. Like after a meal, you could check your data and see how different foods impact your body. Over time, you learn which foods work best for you. It's all about personalization rather than one-size-fits-all advice.
Oh, so it's not like no carbs ever. It's more, figure out how your body handles them.
Right. It's much more nuanced, and that nuance is critical because everyone's body is different. Casey frames it as giving people control back over their health. Real-time data means you're not guessing, you're making informed decisions.
That's kind of amazing. Like, empowering people in a way that traditional healthcare barely even touches, huh?
Absolutely. And Casey's approach highlights the idea that prevention is just as important, if not more so, than treatment. By understanding and improving metabolic health earlier, we can avoid so many chronic conditions down the line.
That's such a compelling perspective Casey brings to the table. It makes me wonder, her brother Calley also has some pretty strong views, doesn't he? Especially when it comes to the role of the food and pharma industries. Can you tell me more about that?
Calley is definitely vocal. He pulls no punches. He's a former consultant who worked within these industries and now critiques the way they operate. He argues that their systemic incentives often favor profits over public health. Together, he and Casey are advocating for changes that would make preventive care more accessible.
Wait, so he used to work in those industries, and now he's calling them out? That's like, whoa, inside man switching sides.
Exactly. His experience gives him a unique perspective, though. He's seen firsthand how policies and business decisions can end up prioritizing revenue streams over what's best for people. For instance, he points to how ultra-processed foods are marketed ubiquitously, contributing to obesity and other metabolic disorders.
Yeah, I mean, it's not hard to believe. Processed foods are everywhere, and they're so, cheap and convenient. What do you even do about that?
That's the challenge, right? Calley is working on solutions through his company, TrueMed. They're proposing that health savings accounts could be used to cover healthy lifestyle choices, like gym memberships or even nutritional counseling. Essentially steering the focus toward prevention rather than waiting to treat chronic disease with medications later on.
Okay, so he's pushing for, systemic change. But are people actually listening?
Well, he's definitely sparking conversations, but critics argue that some of his ideas oversimplify things. Take the health savings accounts, for instance. People point out that they might not help lower-income individuals who already struggle to access healthy options or wellness services. So, while the idea is promising, implementation could be tricky.
Right, because if someone doesn't even have extra money to spend, it doesn't matter if you let them use it for kale or yoga, yeah?
Exactly. And his broader critiques of these industries also stir debate. It's one thing to point out the harms of ultra-processed foods or overprescribed medications, but it's another to implement realistic changes without unintended consequences. For instance, processed foods do play a role in improving access in areas where fresh, affordable options aren't available.
So it's not as black and white as processed bad, whole good. There's more nuance, huh?
Absolutely. And the same goes for pharmaceuticals. While Calley critiques how often medications are prioritized over lifestyle interventions, there are times when those medications are life-saving or essential for managing conditions effectively. It's about finding balance without ignoring the very real consequences of poor metabolic health.
Man, it's like a giant puzzle. Every piece you fix makes another piece wiggle loose. No wonder this stuff takes so long to change.
That's such a perfect way to put it. The key is keeping these conversations going and making sure public health remains the priority as solutions are developed.
Speaking of systemic challenges, Sophia, the Means siblings dive into this deeply in their book, Good Energy. They've been making media rounds. What's the central message they're trying to push?
It all ties back to metabolic health. The book connects the dots between everyday habits, long-term health, and the broader systemic challenges we face. Their goal isn't just raising awareness, but encouraging people to take charge of their health through better lifestyle choices.
Okay, so eat better, move more, stress less. It's that kind of stuff?
Exactly, but they frame it in a way that feels empowering. They emphasize that small changes, like understanding how your body reacts to certain foods or focusing on sleep, can cumulatively make a massive difference in health outcomes. Their media appearances really push this idea of taking preventive care into your own hands.
Huh. I can see how that would resonate with people. But what kind of impact are we talking here? Does putting this message out actually work?
There's evidence that public health campaigns can drive behavior change. When you have visible, relatable advocates like Casey and Calley appearing on podcasts, TV, or social media, their stories and their data can inspire people to start making healthier choices. It's about spreading awareness, and in that sense, it seems effective.
All right. But not to be that guy, isn't there a risk here? What happens when someone hears this and thinks it's a one-size-fits-all solution?
Totally valid concern. And that's been one of the criticisms for sure. For some individuals, especially those dealing with complex medical conditions, lifestyle changes alone might not be enough. There's a fine line between promoting empowerment and oversimplifying what's needed for optimal health.
And I guess if someone hears the system's broken too much, they might lose trust in, like, doctors or hospitals, or...
Exactly. Some critics worry their critiques could create unintended skepticism. The siblings focus heavily on self-empowerment and preventive strategies, which is great, but if it veers too far, it might discourage people from seeking care when they need it, or worse, foster distrust in the professionals who are there to help.
Right? Like, you don't want to go all the way into doctors bad, DIY good. There's got to be a middle ground.
Absolutely, and that's part of the bigger conversation. Balancing thought-provoking critiques of the system with actionable advice can be tricky, and then there's another layer to consider.
That's a good point, Sophia. There's definitely a lot of nuance to balance here. Speaking of that bigger picture you mentioned, what are Casey and Calley actually advocating for in terms of policy? Changing systems doesn't sound like an easy feat.
Right, and they both have a really ambitious vision. They're advocating for systemic reforms that tackle the root causes of chronic diseases. Things like improving access to healthier food options, reducing reliance on ultra-processed foods, and addressing how federal health agencies can sometimes have conflicts of interest when giving public health recommendations.
Wait, conflicts of interest, like agencies being influenced by the industries they're supposed to regulate?
Exactly. For instance, if agencies that design dietary guidelines also receive funding from food manufacturers, it can muddy the waters. Their recommendations might prioritize industry interests over what's actually best for public health. Casey and Calley believe eliminating those conflicts could enhance the integrity of the whole system.
Okay, that makes sense. But how would that even work? Are we talking about overhauling entire agencies or something?
Not necessarily, but it does mean adding more oversight and transparency. They're pushing for policies like stricter guidelines on how food advertising targets vulnerable populations, or promoting subsidies for healthy foods instead of, say, corn syrup. These kinds of changes could shift incentives in a healthier direction.
Huh. Well, it all sounds great in theory, but doesn't this kind of thing usually hit a wall? Like, aren't there always critics who say stuff like this just isn't feasible?
Oh, absolutely. Critics argue that these kinds of proposals are tough to implement. Some of the challenges include pushback from industries that would lose profits, or the very real difficulties in regulating personal behavior. And then there's the question of equity. How do you ensure these reforms benefit everyone, not just those who already have access to better options?
Yeah, I'm guessing a lot of people might say their ideas focus too much on what individuals can do, stuff like lifestyle changes, without tackling the bigger systemic issues first. Is that fair?
It is, in a way. There's definitely a tension between individual responsibility and systemic reform. Critics worry that focusing too much on personal choices might ignore or even downplay the structural barriers people face, like living in food deserts or lacking access to affordable health care. Plus, there's the question of whether some of their business models create their own conflicts of interest.
Wait, what do you mean? Are we talking about conflicts of interest with, their companies?
Right? Both Casey and Calley run companies that benefit from the solutions they're proposing, like using health savings accounts to pay for lifestyle-related expenses. While their ideas are innovative, some critics question whether they're truly impartial advocates or if their businesses influence their positions.
Oof, yeah, I can see how that would raise eyebrows. I mean, it's tricky, right? You want to believe that they're doing this for the right reasons, but running a company changes things, even unintentionally.
Exactly. To their credit, though, they've been pretty open about their intentions. They believe their businesses align with their mission to improve public health. But it's a valid concern, and one that has to be part of the conversation as we think about healthcare reforms more broadly.
So, where does that leave us? I mean, is their vision something that could actually work? Or is it one of those things that's great on paper but impossible in the real world?
I think it's a mix of both. What they're calling for would take monumental effort, shifts in policy, societal norms, and economic structures. But even if not everything they propose gets implemented, their work raises critical questions about how we approach public health, prevention, and equity. If nothing else, they're starting conversations that need to happen.
And I guess conversations are the first step, huh? You can't fix a problem if you're not even talking about it.
Exactly. And even small changes, like reallocating subsidies or improving transparency in policy decisions, could have a significant ripple effect over time. So while it's complicated, it's not impossible. And honestly, isn't that what keeps us pushing forward in systems reform?
Fair point. All right, Sophia, I think we've pushed the system reform conversation about as far as my brain can handle today. Any last thoughts?
Only that these kinds of changes aren't quick fixes. But with the right balance of policy, advocacy, and public engagement, we can start building a system that prioritizes health equity and prevention. It takes time, but it's worth it.
Well said. And on that note, thanks for the great conversation today. That's all for this episode, folks. Catch you next time.